Welcome to 12 to Your Health. I'm Dr. Derek Da Silva. The idea of knee replacement surgery may seem pretty scary, but doctors say thanks to new technology, the procedure is much less invasive and less painful. Here to explain is Dr. Nicholas Alexander with Mahwah Valley Orthopedic Associates. Thank you so much for joining us.
Thanks for having me, Derek.
So, how do you know when you need a knee replacement?
Well, I think the best answer for that, Derek, is when you can't do the things you want to do and you're constantly in pain, then I think it's time to think about having that knee replacement.
So, and let's talk about the pain factor. I have heard, and my brother had a knee replacement, and he's younger than me, that it is uncomfortable, painful. Is it true?
In previous years, I would have said yes. In the last few years, we've been very fortunate. Our anesthesia colleagues have stepped up to the plate and they've incorporated new techniques to really minimize the level of pain to the point where patients are walking within hours after the surgery. They do a lot of nerve blocks. They use a lot of different medications to mitigate the pain and get people moving with less pain.
Now, we have some video that we're going to bring up in just a moment. If you just comment on what we're looking at, I think that the whole idea of, oh, here we go. Go ahead, comment on this. You can, what are we looking at here?
Sure, what we're seeing here, Derek, is a knee replacement. That's an actual arthritic knee, and that's showing that the bony cuts that are done, and that's the metal femoral piece that's being put on there, the bottom piece, and the plastic that sits in between that replaces your cartilage. Obviously, you're not seeing all the ligaments and tendons.
What about recovery? As you said, people are getting up and moving around pretty quickly?
Yes, we have accelerated rehabilitation protocols in place now. Patients are all gotten out of bed immediately, I'd say within hours after the surgery. Typically, patients are only in the hospital for 2 days. The rehabilitation process starts right after the surgery and continues for a period of a good 6 to 8 weeks in outpatient settings.
What is the downside of delaying surgery if you need a knee replacement?
Well, the pain issue is the biggest issue. Certainly the deformity that can occur if the ligaments get stretched or contract, loss of mobility, muscle atrophy, all those things are detrimental. So there's a fine line between doing it too early or doing it too late.
Wonderful. Well, thank you so much for joining us. I really appreciate great information, and I appreciate you taking the time to spend with us here today.
Thank you.